Hello and welcome. I'm Donna Meltzer, CEO of the National Association of Councils on Developmental Disabilities. I'm excited to be here today chatting with some of our friends who live in Hawaii. With me today as my guests are Amanda and her son Ikaika Kaahanui. Did I get that right, Amanda?
You did.
I'm trying hard. Thank you. We're so excited that you two are with us today to talk a little bit about your experience living in Hawaii and how you have been managing through COVID-19 and around some very important decisions that you've had to make around the vaccine for COVID-19. I think many of us are very aware that as this whole past year plus has gone on, things went from bad to getting better once more people were getting the vaccine. Now we have this Delta variant and it's a little bit scary, right? And we know that families all over the globe are struggling with making important decisions, especially not just for themselves, but especially with their children. And Amanda, your son Ikaika is a teenager and goes to school. And we know that the vaccine was very important for you. So we're going to have just some conversation today about kind of how you as a family have navigated your way through this. I'm going to turn first to you, Ikaika, and thank you for being with us today. You're looking very sharp. I love the shirt. It looks very Hawaii.
Okay.
So tell us a little bit about yourself, Ikaika. How old are you?
I'm 17 years old.
You're 17 years old. And so you are in high school, is that right?
Yep, I'm a senior at Kamehameha High School.
Fantastic.
Yep. Senior year, Kamehameha High School.
Senior year, that is so exciting, senior year. Oh my goodness. So I know in Hawaii, because your mom just shared that you go back to school very soon. So your seasons may shift a little bit from other states in the continental US. And it sounds like you go back to school a little bit earlier, maybe than some other students in other parts of the United States. Are you looking forward to going back to school?
I appreciate that.
Are you excited to go back to school?
Yeah, yes.
Yeah. Do you have a favorite subject in school?
Media.
Wow. Well, here we are doing some social media, right? So maybe I hope that this is good for you. You can maybe work with your media teacher to talk about your filming this interview, and maybe you can share it with your school when you return. How do you feel about that?
Yep.
That would be cool.
Yeah, it's a great idea. When you're not at school, Ikaika, what do you like to do for fun? How do you spend your free time?
I like to make my skater watch videos, tour, and play my activities in my room.
So if you caught that, he likes to draw. He has a scooter he likes to ride. He likes to play out stories with his action figures, and he likes to watch videos. He's a YouTuber.
That's really exciting. You know, I've spent a lot of time the last 2 weeks watching the Olympics on TV at night. Have you seen any of the Olympics, Ikaika?
Yep.
Do you have a favorite sport?
I don't know.
You don't know? What's one of the most exciting things we've been watching that you like? Swimming. Yeah, that's been pretty exciting.
And gymnastics.
And gymnastics, yeah.
Gymnastics, yeah. Wow, we have a lot. Go ahead.
And I've seen what karate is about.
We haven't watched karate yet, but that's coming up in the next day or two. Yeah.
Very exciting. Well, we have a lot in common, Ikaika, because the swimming and the gymnastics are my two favorite things as well. So wonderful. Well, it's great to get to know you a little bit and know what interests you and what excites you and a little bit about your life. Amanda, I'm going to turn to you for a moment. So are you a native of Hawaii?
No, I actually was born in Oregon, but I've been in Hawaii for 25 years now.
Wow, 25 years. I think that qualifies as making you feel like a native. But I understand your husband is a native, right?
My husband is local, yeah, born and raised here. And so I'm Kama'aina because I've been here for a long time, but not native because I'm not native Hawaiian. But Ikaika is half Hawaiian.
That's fantastic. So tell me from your perspective, Amanda, as our nation has been dealing with COVID-19 over the last 15, 16 months, how has that felt for you and your family? How has it impacted your life? Have you had to change how you work, what you do in your free time? Are you all, like many of us, still kind of, working from home? Is Ikaika going to school or doing school from home? Give us a sense of what your world has felt like.
Sure. It's been challenging, like for most people. COVID definitely changed our world, turned it upside down. We were able to, in Hawaii, we flipped pretty quickly at the end of the school year. They actually shut schools down, and Ikaika was distance learning. I work for the state, I work for the Department of Health here, and we shut down. And so I was teleworking, which actually turned out to be really good because I could work at my computer. Ikaika could sit next to me here at the desk and do distance learning, and I could support him in his education. So that actually worked out pretty well for us. And then when school started again, it was distance learning, and again I was teleworking, and so that worked out for us. We just stayed home. This is our hub. We feel safe here. We would plan our shopping trips every 2 weeks to get to Costco and the food stores and things like that. But what really was interesting is we got to explore our island a little bit better, because we had to really be creative on how to do that. We couldn't gather, we couldn't go to the main spots. Beaches were still, mostly off limits for gathering or coming together. And so we discovered sort of tiny places. We did road trips to streets that we'd never been down. Often you're driving and you're like, I've never been down that street, but you're driving to work or whatever, right? So we had time to really explore and go places we'd never been as a family. It's actually kind of cool.
Yeah, that's really lovely. Sometimes COVID, I think many of us felt that way. We had different sense of time and different opportunities. Something I want to ask both of you about is, when the pandemic first started, there were some very challenging moments at the beginning. We were unsure of what we were supposed to do, right? We were being told to wear masks. We were told to stay inside. We were told to wash our hands a lot. How did you get good information, and how did the two of you work together, or really the three of you, because your husband's part of the team here too? How did you make sure that Ikaika was getting the information he needed as an individual with a disability? And how did you make sure that you understood what the most important protocols were that your family needed to follow in order to stay safe?
We really had to scour the news, find the right news sources. We're looking at CDC, we're looking at National Institutes of Health, and just really trying to find the right information that we could then make the right choices for. So it really was about kind of scouring and finding where the science was as well. Our local Hawaii chapter of the DD Council was a great place for information for us. We felt we could trust that information. And then we also just had to go with our gut. It's a new novel virus. Nobody really knew a lot about it, especially at the beginning. Ikaika's health status is a little fragile. He's got lung issues. A common cold can send him spiraling into a 10-day asthma episode, potentially hospitalization. So for COVID and Ikaika, it's really important to keep him safe, So we hunkered down, we stayed put, we listened to what the experts were saying, wear the mask, don't gather. And we did probably more extreme things. We washed the groceries when we came home in the beginning, because we didn't know. There was so much we didn't know in the very beginning that we now know. Like, we don't have to wash the groceries anymore when they come home from the store, right? We've adjusted, although we still wear masks when we go out or when we're around other people, whether they're vaccinated or not, because we want to protect ourselves and we also want to protect others around us.
Right. I'm really so glad to hear that your family really trusted the science, trusted the leadership of our Center for Disease Control and Prevention, the CDC, and that your DD council was there to support you with great information as well. Ikaika, how do you feel about wearing a mask? Is that something that you were able to do and still be able to breathe somewhat comfortably?
Wearing a mask is comfortable for me.
Right, he's back at school, and in Hawaii we start in August. So he started school yesterday, was his first day of his senior year, and it's mask up. So we practice at home. We practice, we do go out with him, and we wear the mask that he's going to wear at school because it's a little thicker. And then we went to school and practiced, and looked, where could you have a mask break? Where can you get out of the traffic of other students and take that mask off for a minute and get some good fresh air, and then kind of put it back on and delve back in to flow. Yeah,
that's really smart. I love that advice. And Ikaika, if you'll allow me, I'll share that advice with other people as well. I like that. Where can I find a mask break? Like, where can I go for a couple of minutes and maybe duck into a different hallway or step into a different room that's empty so I can take my mask off just temporarily and breathe a little bit. That's really important. So thanks for sharing that tip for other people who might be watching this video. That's really great. Ikaika, I know a couple of months ago, you did decide that you wanted to get the vaccine. Is that right?
Yes.
What helped you decide that that was the right thing for you?
I want to keep myself safe and others safe.
You want to keep yourself safe and keep others safe?
Yep.
Yeah, that's really, really important. So safety became your primary reason for wanting to get that vaccine. Did you talk about it a lot with mom and dad first?
What?
Did we talk about getting the vaccine before you actually got it?
Yep.
Yeah.
Yep.
Tell us a little bit, Mom, about how that conversation went. Like, was it Ikaika who came to you first, or did you or your husband first talk about it and then sit down and have a conversation with Ikaika? And what kind of things were important for you to know before you made such an important decision?
Well, when the idea of the vaccine first came out, we were, like a lot of people, hesitant, right? It's a new vaccine. It's a new virus. Is it going to be okay? Are people going to have weird side effects from it? And so we sort of watched the science, we read data. We actually read data reports to see, what is the side effects? How are people reacting to this? And then we just sort of followed that science, and we had conversations with Ikaika. We had conversations with his primary care physician, but he's gotten all of his vaccines. We have felt strongly that that's important. He's not had any childhood diseases because of being vaccinated as a child. And so we felt if this was a safe and effective vaccine against COVID, that we felt that we needed to do that for his health and safety. If you've ever seen your child on a ventilator because of a cold, he's been in an induced coma because of a cold, a common virus, a cold. And so we don't know what COVID could do to him, and we can't take that risk. And so for us, we did weigh the risks of a vaccine that's sort of new versus a virus that's really new and we don't know about. And when we started seeing people getting the vaccine, our healthcare workers were getting them. They weren't having huge, there's no big major side effects. People weren't getting sick from the vaccine itself. Then we felt that that was safe. And we talked to Ikaika about what that would look like, how that would feel for him. He's 17, so he got the Pfizer. And we talked about, you'll have a sore arm, you might feel a little bit tired. And he had those, but everything else, he was great. Actually, all of us felt just a little tired, a little sore arm, but no other side effects. So we really felt that it was a positive experience for us.
That's wonderful. I'm so glad to hear that nobody had any big reactions to the vaccine. Ikaika, did you, before you got the vaccine, were you scared of needles at all, or you were kind of used to it? It didn't really matter to you?
Kind of.
Kind of what?
Kind of
used to, or kind of scared?
I'm kind of scared of needles.
He's small.
A little bit. It's a little scary, right? Who went with you to get your vaccine?
Dad.
Dad went with you. That's great. Did Dad get his at the same time? Did you do it together?
No.
No, you got
No, we
them
actually all
separately?
got them different. Yeah.
Yeah.
My husband is older and he's a kapuna in Hawaii. So he's a little bit older. And so he was able to get his vaccine first. Sorry, it's early for us here in Hawaii.
Yes, I understand.
So dad went first. He was kind of our family guinea pig. And then I went next because of my age bracket. And then Ikaika, we had to wait for it to come. So we actually were all in different segments. And so that was also another way for us to see, okay, dad he's strong. We watched and see, did you have any major side effects? No. Okay. Mom got hers. No major side effects, just a little tired in that arm. And then so when Ikaika was ready, we had already been through it. We could explain what that felt like. And we could explain what it was going to be like going through and getting the vaccine. You're in line, you're signing papers, you're going here, you're going there, then you wait. And so we walked him through it. And so it wasn't scary. It wasn't like, what's going on? He felt pretty comfortable going.
When you went for the vaccine, where did you go? Was it a drugstore? Was it a hospital or a pop-up clinic? Can you tell me what kind of setting you had your vaccine?
Cargo ship.
Where was it?
The cargo ship.
Yeah, it was actually down what we call Pier 2. It's where the ships would come in, right? The big cruise ships.
Cool.
There's a place downtown where they come in, and it's a big open space where they would, the passengers would disembark from the ships. Yeah. So Hawaii Pacific Health was one of our major hospital organizations here, networks, and they had a vaccine clinic. And so it's easy to make the appointment online. You drive down there, they validate your parking, and then it's just like, station 1, do this, station 2, here you go, line up over here, go to your next thing, wait for, for your 15, 20 minutes, and then off you go. So it was such an easy process that they had created there. Yeah.
That's really great to hear. We talk with people across the country as we're trying to get more sites available that are accessible and easy for people with a variety of different types of disabilities to get to. And some people, as you probably know, Amanda and Ikaika, some people can't leave their home at all. And so we're focused on helping vaccinators get to the homes of people with disabilities as well, for those who can't leave. But it sounds like you had a really smooth and easy opportunity there. And it sounds like it was actually in a very beautiful setting and someplace, kind of nice to be. And Ikaika, were they nice to you when you got your vaccine? Were they helpful? Yeah, that's great to hear. Good. Nice, yeah. So Ikaika, now, that you are vaccinated, or I know this was a few months ago already that you got your vaccine, what did it help you to be able to do? Did your life change after you got the vaccine, or did it stay the same?
What are you talking about?
So when you got the vaccine, did life change for you?
Mentally or physically?
Both, mentally or physically. What happened mentally when you got the vaccine? How did you feel about things after that?
I just felt normal, like taking the cure for COVID.
You felt normal, like you had a cure for COVID? Okay, and how did you feel physically? Did you feel any different after you got the vaccine?
I got my arm sore.
Yeah, arm was a little sore.
Yeah, I had the same thing. My arm was a little sore. I did those move your arm around for a couple of days, right? Kind of shake it through. But it sounds like, but it sounds, Ikaika, like maybe just mentally you felt a little bit better, a little more confident maybe, because you knew that you were protected because you had the vaccine.
Yeah, and because he spent the whole year distance learning last year, we actually worked with the IEP team in the school who had gone back to hybrid at the second semester. But we felt Ikaika wasn't vaccinated and it wasn't safe for him to be in school yet with other vaccinated people. So we stayed home the whole year. He distance learned and did very well. Right. And once he got the vaccine, it was prepping them then to get back to school. He got it in May. So okay, when school starts again in the fall, if it's safe to do so, you'll be vaccinated and you'll be protected. You'll have that layer of protection. So we were actually working through the summer, getting him ready to go back to school because he's vaccinated.
So, Ikaika, if you could give advice to other teenagers, other people your age about the vaccine, what would you tell them?
Again. Okay, I'll try that one again. Sorry. This is where we'll have a little.
Such a teenager. I love it.
Okay,
What?
so ready for that one?
What? What do you say?
What advice would you give to other teenagers?
What do you say after that?
No, I want you to refocus. Okay.
Okay.
Okay, here we go. I'll have the question again.
What advice would you give to other teenagers about the vaccine?
Just grip a lot.
No, what do you feel from your heart? If you could tell your classmates at school who don't yet have the vaccine, what would you tell them?
Vaccine is safe and it's good to take.
Vaccination is safe and it's good to take. I love that. That is perfect advice. Perfect. Thank you for that. Amanda, any other thoughts or anything that you think is really important as we continue to try to make sure that everybody, including people with developmental disabilities, have access to this vaccine? Any other things you learned along the way that you think are good advice for parents as they're making these difficult decisions about their teenagers, and eventually, we hope sometime maybe this fall, even younger children will be vaccinated? What would you say to parents who are maybe hesitant or still trying to figure out what to do?
Right. It's a hard decision. And when we first were thinking about the vaccines, we thought it's a very personal decision as well, because it's a new vaccine. But as time has gone by, months have gone by, millions of people have gotten the vaccine, and we haven't had major side effects from them, right? There's always going to be somebody that's going to have an adverse effect to anything. There's always going to be somebody out of that mix. But what we want to help families understand is that this is a safe vaccine, and to really consider it, because we don't know the long-term effects of COVID, right? We don't know how this is going to affect our kids. This virus will stay in your system. You may get over the symptoms, but we don't know what will happen later. And so to protect yourself, to protect your keiki from having something that could last long into their life or affect their life permanently, please consider getting the vaccine. And it's not only for yourself and your family, but it really is about public health at this point, public health and safety. We are on a huge spike again in Hawaii. We thought we had it under control, and then this Delta virus, it's a brand new virus. It's really different. And so we urge our friends and families to please consider getting that vaccine, not only for yourself, but for us as well.
Thank you so much for sharing that. I think both of you have given us some great insight today and shared so much. Ikaika, thank you for sharing your story and talking with us about your ability to get the vaccine. It has led you to be able to safely go back to the classroom in real time instead of being on video. I know that's important to you. I hope that being vaccinated and staying healthy will help you to be able to continue doing all the things that you enjoy doing, whether that's in school or in your free time, and doing sports and watching sports and all of the things that you really enjoy. So I'm glad that you're healthy and you're safe, and that you're a real leader in your community and amongst your friends for getting the vaccine early. And Amanda, thank you for really sharing with us what it's been like for you. And I think we all appreciated hearing how you and your husband made this decision for Ikaika, or with Ikaika, I should say, because he really was a part of this conversation as well. And I think that's really important. Teenagers know what's important for them, know how they feel. And it was just great to hear that your experience was easy, it went smoothly, and has had really good results. So we're just so pleased for your family. We wish you all the best for good health. And Ikaika, I hope you have a great school year. And we look forward to seeing more of you as time goes on. And we hope that you guys have a great rest of your day. Thank you for joining us at NACDD. Thank you for being involved with your Developmental Disability Council in Hawaii. I know that you're a big part of what they do, and we're thrilled about that. So thank you again so much for being on with us today. We appreciate your time.
Thank you so much. Mahalo.
Mahalo.
Aloha.
Aloha.
Aloha.